Hi, my name is Christine Walsh, and today I'm going to be presenting my validation for a central line dressing. So the first thing I'm going to do is do my 7 steps, which is to check the doctor's orders, identify the patient by looking at their wristband, explain the procedure, introduce myself, gather all of my equipment, wash my hands, and provide for patient privacy by pulling the curtain around. So the first thing I'm going to do is I'm going to bring my patient up to a working level. So my patient's at a working level, and just so I can have better access to my patient, I'm going to bring this rail down. Okay, so my rail is down, and I'm going to expose the wound, say, over here. And I'm just going to, before I take the old dressing off, I'm going to look at it and assess for any redness, irritation. I'm going to ask the patient if they're in any pain or if it's irritating them. And then I'm going to ask them before I start anything to not touch the wound site because I don't want them to interfere with what I'm doing. So the next thing I'm going to do is I am going to open my central line kit. And I have my garbage bag over here on the side of the bed. Okay. And when I open this up, I have to be mindful that I am not touching anything inside the sterile area. And while I'm opening this up, I have to make sure that I am only touching the outer 1 inch of the sterile field. Okay. Alright, so now that this is open, I'm going to put my clean gloves on. And I'm going to wash my hands before doing so. So my gloves are on, and what I would also be doing is, if this kit came with 2 masks, I would be putting 1 on the patient and 1 on myself, but because this kit only comes with 1, I'm going to instruct the patient to keep their head facing away, and her head is already facing away, so we're set with that. So I'm going to put this mask on myself. Wrap it around my ears. Alright, so this is wrapped around my ears. I'm ready to take the old dressing off. And I'll do this carefully. I don't want to hurt the patient's skin. And all while I'm doing this, I'm asking the patient if they're in any pain. So my old dressing is off. I'm going to put this in the garbage, and I am going to take my clean gloves off now and put my sterile gloves on. I'm going to put my sterile gloves over here. And like the sterile gloves, the sterile field, I'm only touching the outer inch. And before I put these on, I'm going to rewash my hands. now because this hand is sterile, I can touch the entire part of this glove. Alright, so my sterile gloves are on. I'm going to begin cleaning the area. I'm first going to take my alcohol swabs and clean the tubing. Okay. And I'm going to set this down here. And I'm going to be going from the inside out. I'm going to take this last one and I'm just going to get the tubing. Okay. So I'm going to let that set for a little bit and then I'm going to get my ChloraPrep applicator. So now I have my ChloraPrep applicator. I'm going to click this to activate all the cleansing. All right. And I'm going to make sure I'm creating friction, going in horizontal and vertical lines around the site, not creating friction where I'm hurting the patient, but enough friction where I'm cleaning the site and making sure that everything is taken care of. Okay. So now that my site is clean, I'm going to throw this away. I'm going to let the skin dry for a couple of seconds. Still waiting on that being dry. Okay, so that looks about dry. And we are going to put our dressing on. And when I put this on, I'm going to make sure there aren't any air bubbles so that no bacteria get in. Okay. Okay. And I'm just going to take this outer seal off. All right. So my seal is on. Everything is on here. There's no air bubbles or anything that could get bacteria in the wound. So I'll get rid of this. The last thing I will do is on this piece of paper, I'm going to put the expiration date of the wrapping, my initials, and the date and the time that I put the new dressing on. And I'm also going to make sure it's not over the clear portion because I want to make sure that it is able to, the site is able to be seen if there's any signs of infection going on. And then the next thing I will do is I would wrap up my sterile field. I would clean up my area. I'm going to redress the patient, ask them if they're in any pain before I leave them. I'm going to bring the side rail back up. So the patient is in their lowest position. I'm going to make sure that they have their call bell next to them. Before I leave their room, I'm going to make sure if there's anything else I can get them, I will do for them. And then once I am done here with the patient, I'll take off all of my equipment and I'll discard of it. And then I will go and document what I did.